the fundamental distinction between those of us who are campaigning for regulation and control and those people who support prohibition is that we accept reality. We're dealing with the reality of a world in which people use, people supply, and people grow drugs. That is the reality.
People think that legalization means making available drugs that are not now available. In fact, all of the drugs are available. They're available in the black market. And it seems to me, if they're going to be available, better to make them available in a legally regulated, controlled market than in the underground.
By any rational standard, this has to be a crazy situation. And are we really to believe that there is no more viable alternative, no more sane arrangement?
The first thing that we need is a better analysis of the problem, a better theory. It is still the same as exactly in around 1912, that if only you prohibit the substance and you fight the users and the use and the trade, that then, well, maybe it will not be eradicated, but it will certainly diminish.
There is outrage, as there often is on a Sunday morning, over a taxpayer-funded booklet which guides users on safe ways to inhale and inject party drugs. The booklet is published by the former AIDS Council of New South Wales, ACON. It gives tips about how to protect the nose when snorting drugs such as cocaine.
Health authorities say the booklet is aimed at harm reduction, but there are concerns it will encourage drug use. So is it harmful or helpful? It's over to our Weekend All-Stars comedian and author Tim Rosso-Ross and social commentator Prue MacSween. Good morning to both of you.
Prue MacSween.
Prue MacSween. Jeez, that's a Scottish name, isn't it?
It sure is.
Oh, and Tim Ross. Don't forget Tim Ross.
Keeping in the family today. Prudence, should this type of booklet be allowed, do you think?
No, of course not. Isn't it absurd? I mean, there is no safe, responsible way to take drugs. Full stop. It's absurd that this harm minimisation, harm reduction. Look, we are going crazy as a society. We are saying that this is acceptable. It ain't acceptable on any level. And the more we tell generations that it is fine to do it and here's the right way to do it, there is no right way. Get a grip. And I'm really offended that my taxpayer money is being spent on this.
Prudence, to be fair, this the booklet wasn't about drugs itself. It was about sexually communicable diseases or communicable diseases generally. And, you know, snorting or sharing snorting equipment is a way to pass on hepatitis C, so ACON says. So, you know, don't you think acknowledging what does happen in the world is one way of minimising?
Yeah, I think that's true, but, you know, frankly, put a condom over your head and don't do anything. You know, then you will know you won't get hepatitis and you won't get all the other things.
Life if you require a condom
I mean,
on
it's
your head,
just absurd. I agree that we need to educate people, but let's educate them about the dangers of taking drugs, full stop, not how they can do it safely and responsibly. I'm sorry, it just doesn't cut with me at all.
Rosso,
well, no one's cut with you in a while by the sound of it.
Rosso, how do you feel about your taxpayer dollars going toward this sort of thing?
Look, this harm minimisation reduction has been a long-standing policy in this country, and we've certainly seen it work with young people and ecstasy. The idea of it is that we know that people are going to take drugs. It is their choice, and it's unfortunate, but if they're going to take it, we need to have them in a situation where they're taking them in a safe way. And I think ecstasy is the prime example of that, where young people have been told to take water and not to go mad on them. I think the stranger thing is, in this day and age, making booklets is stupid. You know, I think you know, you make a whole bunch of booklets, they sit in the doctor's surgery, no one touches them. You know, a good website will work, and maybe some TV ads or something like that. But you know, we do have to look after people, and I don't think this policy is going to change.
Yeah, fair point.
All right, moving on.
It seems like...
Well, it's hard to move on. Hang on, before we move on. The booklet does warn readers not to mix their utensils with those of other people. It doesn't mention what utensils. And you can avoid that by putting a post-it note on your utensil with your name on it. There you go. So if you go into someone's kitchen and their egg whisk has a post-it note with their name on it...
Don't use it to inject
drugs. You're probably using drugs.
Not to put too fine a point on it, shit happens.
Drug users are denied information about HIV prevention, harm reduction and safer drug use. Governments ban publications about drug use or harm reduction. Government officials harass individuals who speak publicly in favour of needle exchange, methadone or other harm reduction measures.
And amongst other things has created a trade worth £2 trillion over the last 10 years, and provided significant momentum behind the transmission of HIV/AIDS and brought horror to some of the most disadvantaged people on earth, which is quite something for a policy that claims to reduce production, supply and use and harm. Why don't we have the data? The reason we don't have it is because governments don't want to do it. The reasons they don't want to do it is because they don't want to expose prohibition to scrutiny, because if they do, it will be shown to be cost ineffective, well-being ineffective on every single indicator you would care to mention. There is a political block to exposing policy generally, but specifically prohibition, to any scrutiny whatsoever. And I can cite you numerous examples where the government has avoided scrutinising prohibition, and where it has deliberately hidden the evidence and made sure that the public don't get hold of it.
We're not treating them. We certainly are not dealing with the problem of drug addiction by putting people in jail, and these same people come out again, so it's hard for me to see how you're winning the war.
Drug users die in locked hospital wards. Police beat people suspected of using drugs. Investigators force drug suspects into unmedicated withdrawal to extract confessions.
We need evidence to show that strategies and tactics are working, and the evidence favours harm minimisation as markedly reducing the uptake of illicit drugs. And that is done primarily through educating our young as to how drugs affect them.
The UNODC Executive Director insists that containing and stabilizing the world drug problem represents major success.
I think that is an extraordinary result of the 40 years of very major increases. A runaway train which stalled. Is that progress or not?
Well, if you look at the availability of heroin and cocaine, there's nobody there who would call that success.
Well, I'm afraid you're picking the wrong example.